Recording. Welcome everyone to our Pull Up a Seat, our October Pull Up a Seat on financial burdens to care, breast cancer care. As we get started, I'm Shonda Cooper, Chief Program Officer at Tigerlily Foundation. Please make sure to drop in the chat where you're zooming in from. I know we have ATL in the building as well as Chicago. So please, let us know what you're zooming in from, and excited to have you all here. Okay, I see Boston, Milwaukee, Huntsville, Alabama. Great. All right, so welcome, South Jersey. Okay. All right, so we're going to get started. Again, thank you everyone for joining us for this really important conversation about the financial component of breast cancer, going through that breast cancer care and survivorship, and that navigating through that journey is something that we don't talk about enough, and there's so many layers to it. And the more that we're able to come together and have conversations, the more that we're able to share resources and to be able to help one another. And so we're so excited. I'm so excited on behalf of Tigerlily Foundation to have you all on, as well as to have our phenomenal patient experts that will be sharing not only their stories, but also sharing some of the resources that have been helpful for them as they've continued to navigate, navigate this journey. So I am going to do introductions as well, set the 5 agreements as for this space, explain our reason for our Pull Up a Seat, and then also turn it over to our patients for their patient expert experience. And then we're going to hear from Dr. Megan Edmonds, who will speak on the topic financial burdens, and also looking at solutions. And then we're going to come together and have an exchange of ideas, led by our patient experts and the attendees. And then, yes, we'll just have, since it's an intimate group, we're going to be in this space and we'll be able to have conversation. I invite you, as we continue through and you hear from these incredible women that are on, as you hear from Dr. Edmonds, to write in the chat, share, what your thoughts are, comment in there if you have questions for them, follow up if there are additional resources as well that you are aware of. Specifically, nationally, but also in specific states. As you can see, we have a diverse group from across the country, and some of those, grant or some support is, it's in specific areas. So the more that we're able to provide that, the better. 5 agreements. So I ask you all to monitor your airtime, speak your truth, speak from your own experience, lead with curiosity and not judgment, and most importantly, keep this space safe. Our why are our advocates. Our why are the women that are part of our community, their families. Our why is to educate, advocate, and empower young women before, during, and after breast cancer. We hope, and our vision is that we envision a future where breast cancer diagnosis does not inspire fear, but it ignites hope for a future. This goes for the same as it relates to even the cost. That the fear that's around this, and the fear of trying to navigate a breast cancer diagnosis while also thinking about your life and how your livelihood and how you're going to make it through with all of this. Our hope is that as we continue on with this conversation, that this is something that will ignite hope as well for those who are continuing on with this journey and have been impacted by it as well. So we have our conversation. It's No More Disparities and Pull Up a Seat. It's a two-part. Last week we had No More Disparities, which is a space, it isn't recorded for us and by us for Black women to come and talk about health inequity, talk about racial biases, talk about lessons learned. The concept is that the more that we understand and know about disparities, the more that we can say no more to disparities. After 2 weeks, after a week, we have our Pull Up a Seat conversation, which is co-hosted by Black patient experts and a Black medical health professional to amplify the voices of Black men and women through candid conversations on topics ranging from racism in clinical trials to practices of unequal health treatments through all stages of breast cancer. So now that I have shared all that with you, I'm so excited to introduce you to our phenomenal panel. We have Lisa Weems with us. Lisa is a 2-time breast cancer MBC survivor. Faridah Thomas, who was diagnosed with triple-negative breast cancer in December 31st, 2020. Kimberly Skinner, who is a proud mother of 2 and a fearless triple-negative breast cancer warrior and advocate. And Eboney Thomas, a phenomenal speaker, author, transformation, mindset, business coach, and also a stage 4 breast cancer survivor. So we are so excited to have you all on. And I'm going to pass it over because it's most important to hear from you and to hear your stories in your own voice. So I'm going to stop sharing my screen so we can see these incredible women. And I'm going to ask Lisa to kick us off and share about your experience going through this, navigating breast cancer in Chicago.
Thank you, Shonda. Thank you, everyone. I'm so honored to be here and to be in the midst of wonderful women and to share my story, and hopefully you find value in my experience. Piggybacking off of last week that we discussed, I was diagnosed with breast cancer in 2017. I was fully employed, and I did not know that you could ask for accommodations at your job so that your job is protected. No one told me. And so as my breast cancer progressed to metastatic, and I became lymphopenic, neutropenic. Of course, I'm working in a healthcare setting with patients that are sick. Of course, my doctor was alarmed at me being exposed to people with colds, flu, pneumonia. So he suggested I, fill out a reasonable accommodation. I did not know what that was. And so I filled it out, gave it to the HR department, but they didn't accommodate me. I also did not know not every company will accommodate you. You can request it, but you won't always be accommodated, such as if you're being treated for cancer and chemo, a private office so that you're not exposed to people who may have colds. So a lot of back and forth with my employer, them not accommodating me. That went on for until something was recommended as far as FMLA, family leave, medical leave at absence. I didn't know what that was either. And so that your appointment, as you know, breast cancer patients have several appointments. So that was a form I had to fill out as well. So otherwise they were threatening to fire you because you're taking so many appointments. And it's very stressful for breast cancer patients to keep taking appointments, and the employer doesn't want to accommodate you for the appointments. And so what happened was I had to transfer during the pandemic because, of course, I could not work around COVID patients and being treated for breast cancer. I had to transfer to a job that afforded me to be at home. So I transferred to the Small Business Association working from home, but that was a temporary job. And once that temporary assignment was over, then I was unemployed. And so I discovered quickly that oftentimes when you are being treated for cancer, sometimes you are not accommodated, even though you're covered under the American Disability Act. And oftentimes people who have disabilities or cancer treatment often fall into unemployment, which then causes financial hardship. And so my hope today, I'll leave some links today, is there are resources available to you. FMLA to protect you for your appointments, reasonable accommodation, but not all companies will accommodate you. So just be knowledgeable about that. And two, there are many organizations, American Cancer Society, Weems Foundation, that provide grants to help you financially during that time of transition of unemployment until you can find employment. I also will leave an article that talks about how women of color typically are not accommodated. Those are some of the barriers that we encounter as opposed to women that happen to be Caucasian, and they are usually accommodated. And so it's important for us to advocate for ourselves and be knowledgeable that we are afforded the FMLA, we are afforded the reasonable accommodation, and to make sure that you cover your tracks and fill out those forms so that you are accommodated, so that you don't have lapses of employment. And so it's my hope that my story, that it helps someone today. So thank you for allowing me to speak today.
Thank you, Lisa, and thank you for sharing about your experience, from understanding and learning about reasonable accommodation to understand about FMLA and covering how that covers appointments and treatments, as well as learning, providing more information about your experience of this being in Chicago and what you had to learn and what was provided to you before. And so just thank you for providing that information so that hopefully there won't be as many individuals who have to go through this with having to go through lapses, different periods of unemployment, because they're trying to not only literally work to save they're putting money towards saving their life, but also having that opportunity to focus on that and not thinking about these that they have an employer who's also supporting them in that process. So thank you for being here. I know you're on your way to your doctor's appointment, so we appreciate you. I am going to pass it over to Faridah Thomas to share with us as well.
Good morning. Hi, everyone. My name is Faridah Thomas, and I was diagnosed with triple negative breast cancer in December of 2020. And at that time, I was all excited. I'm like, you know what? I made it through the entire year, no COVID, and to get a cancer diagnosis. That was pretty harsh all in itself. Also dealing with a pandemic where I had took off maybe about 3 months from my job because I work for the airlines. And so the airlines, when the government shut down everything, we weren't flying planes. So we were all out of work anyhow. So I had decided to pinch back and try to save some money just because, I knew I was off and I had put up money for a rainy day, but nothing expecting a cancer diagnosis. And so with having a cancer diagnosis in December, it was a lot to take in. However, I was starting to think, I'm like, okay, I got this. I can handle this. I have great insurance, blah, blah, blah. Well, the thing about the cancer and the cancer treatments is that you have so many appointments. So you're constantly going to the doctor. It's co-pays for everything. And these scans, they're very pricey, the PET scans, the MRIs, the mammograms, and they're trying to figure out what's going on with your cancer. So they're doing everything to, in detail to try to figure out what stage you are, where the cancer is it anywhere else in your body? So you're going through so many different things while they're, trying to figure out what's going on with your cancer. However, if you have one of these insurance plans that has a high deductible, then you're left stuck with trying to figure it out with your own finances. For my case, I had to pull into my savings, also with my 401k to take care of my expenses. It became overwhelming after my surgery because during the surgery I had to pay upfront a certain amount of money, which I hadn't planned for. However, I had to do it. I was willing to do whatever I needed to do to save my life. And so, going through the surgery, after cancer, you still have care and expenses that you need to make sure that you're still doing okay and to continue your treatments. Like for me, with my surgery, I have a condition called lymphedema. And so my arm swells, it's like in my breast. It's kind of painful, but anyhow, that's a part of my survivorship. But the thing about it is with the financing, basically, my insurance was great. They paid for basically everything. The problem that I had wasn't so much of the insurance, it was more so of the deductibles and all of the things that you have to do. And it's just, if you're not told about some of the things that kind of catch you off guard, your bottom line is that you want to make sure that you're saving your life. So you're not really thinking about the financial part of it. You're more so, going through the mental aspect of it. You're dealing with all of that. And so, it's pretty harsh. It's harsh on the mind, the body, and definitely the finances. And I could see that if I didn't have the great insurance that I had, I'm not sure exactly where I'd be because I actually seen people that weren't receiving certain treatments because they either didn't have insurance or they were underinsured, things of that nature. So, anyhow, at this point in the first time in my life, I'm paycheck to paycheck, which is I can't even really relate to it. It's almost like, okay, Lord, this need to pass over because I'm not used to this. But I'm still in debt. I'm working it off. Um, I'm optimistic, but yeah, it took a lot. It took a lot out of me, and it took a lot to still continue to try to get back to where I was because in this moment, I'm still receiving medical bills that aren't paid. And, I can only do what I can do. Bottom line was to live. I'm here. I'm thankful that I'm in remission at this time. And I'm happy to be here to share my story, and I'll share more with you guys later. Thank you.
Thank you, Farida. Thank you for sharing
You're
that
welcome.
and for, being brave to provide that information and share that you are at this point in your life living paycheck to paycheck. And I remember last time when we spoke, you said something. You said I spent a lot of money trying to save my life, and that just really resonated. Like you said, right now you're not thinking about that. You drained your savings. You did all of this to be where you are now. And, as we continue on, hopefully we can be able to continue to see how we can help to support you and others who are in this space. That as you move forward, that you aren't thinking about like, continuing to move into what is this new normal with a huge bag of bills, because of having to work, literally save your life, spending money to save your life. So thank you, Farida. I'm going to pass it over to Kimmy Skinner to share. Kimmy, I know that since we had your video that we shared the last time, I wanted to also be able to know if it's okay to share that with everyone that's on. So I'm going to share a video that Kimmy, participated in for our My Life is My Legacy campaign. And after that, we will hear from Kimmy.
We can't hear anything on it.
Oh, thank you. All right, let me pause it. One moment. I was just about to check to see if that was the case.
Okay, it should work now. Let me start it over.
After my cancer diagnosis,
Can you hear it now?
I became homeless. I had to make a decision of doctor's appointments or utilities, medications, or clothes. Hi, my name is Kimberly Skinner, and I'm a triple negative breast cancer survivor. I have done nursing since I was 22. I worked in urgent care and I was an x-ray tech, and that will be the same place that I will find cancer. Cancer will meet me in that same setting. And I am one that's always giving the diagnosis and holding hands. So getting a cancer diagnosis, I was on the other side of it. I was almost promised that it was not going to be anything. It was just going to be maybe a fibrous mass or a cyst, but definitely not cancer. I asked for a biopsy to be done of the mass in my left breast, and it was taken as if I was rushing the physician, and it was almost like I had offended the doc by asking him, hey, are you going to do a biopsy? We did it, and he rushed through it, and he said, you just have a clogged milk duct. So I went for a second opinion, and I was misdiagnosed the second time, and they told me it was a cyst. On 12/31/2019, at 9:34 is when I got diagnosed with cancer. Being diagnosed in a pandemic, life shut down. How was I going to do treatment in a pandemic also? So I had all these different things going on in my head. I worked in the beginning until chemotherapy got too much. I became really weak. That's when life threw another curveball. I had insurance for the first initial treatments, and then I lost my healthcare coverage because I was no longer employed. I became homeless because I didn't have a job, so I couldn't pay any of my rent or any of the expenses that go to take care of yourself and two children. I think several days without eating, and I ended up in the hospital because I was trying to make sure that my children ate anything that I had. I was just pouring into them. I would skip my medications because almost $400 a month for maintenance medication wasn't really feasible. It wasn't something that you could do on no income. I never had time to be weak. I just had to fight. I don't think anybody even knew all that was going on until after I had come through it. I didn't want him to be a burden on anybody. I said, you misdiagnosed me, and he just wouldn't go straight. And he left the room, and he came back, and he said, I just wanted to see if we could just talk about it. And I said, it's not for any malpractice or anything. All I want is to be a change. Change how you see people. Change how you treat your patients. Take the time to actually see them and hear them. And he says, you've changed how I will forever practice. The way healthcare is set up, it is not patient driven. And I think that sometimes physicians get so used to their day-to-day and they stop seeing the patient as human. I want physicians to take the time and just hear them, take the moment to address it. For me to have lost health care coverage, I think that everyone that has that diagnosis should be able to just worry about getting better, no matter what age you are. And that's what I want to see somehow that incorporated, that we can just focus on getting better. We don't have to focus on medications, the cost of treatments, the cost of chemotherapy, the cost of radiations, that we can just heal and take the time to heal. Your question can be the change in life or death. Kick down the doors. Make a seat for yourself at the table to have your voice heard so that change can happen, that the patient is not ignored, that diagnoses are not just rushed through. I started a nonprofit, Kimmy's Closet Incorporated. I sent out a comfort pouch and it has anything from chapstick to socks to a quote that I've written to poems. And so that's what I do. I take care of the Pink Sister after they ring their bell. I sit in my car and I was doing some research on my phone and Tigerlily Foundation popped up and I finally saw myself. I hadn't seen myself in anything up until that point that anybody that looked like me. So I was like, hey, I can do this. And that's how I became an advocate. Going through their angel program helped me to empower other women, other men in my community that look like me. My legacy means to me is what is said about you when you're not in the room. What is said about your life when you're no longer here in this realm, in this life. For my children, I always want them to know that I fought and I fought to the end. I am Kimberly Skinner. This is my life, my legacy.
Thank you. Wow. Thank you, Kimmy, for sharing and for that video. I'm going to pass it over to you.
Even though I lived it, it still gets me choked up. You say my name is Kimmy, and I was diagnosed with triple negative breast cancer, stage 2B. Misdiagnosis, all have seen, and if it wasn't due to me knowing that I've been with my body the longest and to listen to it, I probably wouldn't be here in this room, being able to talk to each and every one of you. The financial hardship that cancer brought was devastating. From living in a 3-bedroom home to living in a car with 2 children driving around at night so they wouldn't get carbon monoxide poisoning. No one told me that everywhere I turned, it would be a fight. Fight for life, fight for financial resources, fight for mental resources. I'm thankful that Tigerlily popped up in my search. But I noticed that there's nothing, well, not nothing, there are limited resources for post-treatment. It is deemed that once you ring the bell, your journey has ended, but for most, our journey has just begun. We focus so much on just fighting. We go through appointment, and we really don't even face the fact that we have cancer, what all that entails. From a financial aspect, I lost everything. My accounts were negative. Right now, I have $55,000 in medical bills. Nothing that I have seen is going to help with that. They want a payment plan, but if you have no funds, how can you have a payment plan? I was also deemed incompetent, non-compliant, because I wasn't going to appointments and I wasn't getting my medications. And that infuriated me because I wasn't being non-compliant. I had to decide on to feed my children or go to an appointment and pay a copay. I had to clothe my children, get winter coats, or get medications or food. They said I ended up being admitted because I had became very malnutrition. I was actually hospitalized for 3 days in a coma. My body just shut off right there in March of this year. My hope and my prayer is that women can have the same care and treatment that children have and their elderly have, that they can just focus on healing, focus on getting better, and not have to worry about the cost of such a huge diagnosis. I became an advocate just so I can be the change that I want to see. I never want anyone to have to experience being so sick and living in a car. That's all. I just want to be the change. And I thank you for letting me use the platform to share my story.
I'm on mute. You are the change. Even with everything that you have gone through and you continue to go through, you have continued to, and you continue to be an example of perseverance and all that you've gone through. And we just thank you for your transparency, because it's so important for us to hear this so that we can know what to do and to be that voice for so many. I know that last week when we talked, there were individuals on who talked about having their car repossessed, who talked about these things. Like it's something that isn't talked about, but is so important. And I just honor you for sharing that and being able to provide that, and all that you've done and continue to do for your children and for those around you by being a voice. So thank you, Kimmy. I think I see I'm looking for Eboney on here. Eboney, I'm going to pass it over to you to please share your story as well. And then after that, we're so excited to have Dr. Edmonds as well to be able to provide us with some additional information. So Eboney.
Good morning, everyone. My name is Eboney Thompson. So I was diagnosed December the 28th, 2018. By the time I resonate so much to, I resonate with a lot of people's stories so well, because I was also misdiagnosed. I was misdiagnosed in 2015. The doctor was like, hey, I felt the lump. I originally felt the lump. The doctor was like, oh no, you're Black. You're young. Because at the time I was only like 35. And they was just like, oh no, you're fine. You're good. So, I was like, why would I question the doctor? Now, hindsight 2020, I really wish that I would have. And so I fast forward December the 28th, got rushed to the hospital for shortness of breath, only to find out that not only I had cancer, not only did I have cancer, but it had metastasized to both of my lungs, 50% capacity, my bone, my spine, and part of my pancreas. And here I am. It's like, okay, God, what do I do with a diagnosis like that when you're a single mom of 4? I was at the height of my career. I worked in finance. I had my little nest egg. I had been in California. I had moved from Kentucky to California. And here I am. And if you know anything about California, yes, it's beautiful, but it is expensive. Beautiful, because what we do, we're probably paying for our weather. However, I was doing great in my career. I was just doing great. And so it was just like, okay, God, here I am. I do have a nest egg. I still have my 401k from the job that I had before I moved to California. But nobody tells you, everybody's like, oh, fight, 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 fight. And yes, I am. I'm fighting for my life. But nobody told me about the financial hardship part of it. Because when I was diagnosed in the hospital. I ended up being in the hospital for 2.5 weeks. The company that I worked for was a small company. So they ended up downsizing, so to speak. And who got kicked out? I did. So now here I am fighting, and now I'm going through savings. Okay, savings is dwindling very fast. I was fortunate enough to, my little girls at the time were 6 and 10. And so their school did a GoFundMe for me, and they raised $15,000. For some, $15,000 is a lot of money. Once again, it's a financial, it is, I was very grateful. However, when your rent is almost $2,000 and you have 4 mouths to feed, and that's just rent and not utilities, phones got cut off. And so I would have to use Wi-Fi, make sure that, because we have Apple phones, so we were able to iMessage, but we would only, so my phone was off for almost a year. And somehow, by the grace of God, we had that to work. We found mold in my apartment. So then it's like, now I gotta move, but I can't find a place because first thing here, well, they usually want 2.5 to 3 times the rent. I can't give you that if I'm not working. So what happens? Me and my kids ended up in a hotel for almost 3 months. And I'm just like, oh my goodness. So what does that do? Now I have to tap into my 401k to pay for it. So now I'm paying for all of that stuff. And then there's alternative treatments. I ended up, going through trying to do alternative treatments, because my whole thing is, you fight. I am like, I have to be here for my kids. So I'm going to do any and everything. So I'm going to naturopathic doctors. That's $3,000. And just money was just going down the drain. And then before you know it, accounts were going negative. And now I'm bribing Peter to pay Paul, only to sit there and then nobody tell me, oh, because you're stage 4, you can apply for Social Security disability. So I'm just like, okay, but then the Social Security disability, that's fine, but what do you do when the people who are supposed to process out your paperwork, they fall through the cracks? So here I am in the midst of chemo, in and out of the hospital, trying to get money, because it's either you pay the light bill or you feed your kids. You try to pay, and I'm still trying to get out of the hotel. By the grace of God, I found a program that would give you up to $3,500 to be able to move into somewhere to stay, and found an apartment that only did one time the rent. So that was definitely a blessing. You don't find those places around here like that. And so I was able to move into the apartment that we in now. And then I went through a program that they helped you with some financial assistance. But as of right now, the only thing that I really get is Social Security disability, which kicked in. But even then, it's barely covering the rent. So it's trying to find side work. It's trying to, I'm fortunate enough where I'm business minded to where I can do some things on the side that allow income to come in, but all the income goes to bills and raising the kids. And, I tend to feel bad as a mom, because it's like, we don't really get to go out to dinner like we used to. We don't really get to do those extra things like we used to, like maybe a vacation. And I'm talking about even like a staycation. but it's either people don't talk about those things of you literally have to fight to live. And it's not just physical and mental, but it is a big, big hit to the pockets. And then especially being a Black woman, because most of us, a lot of us, we're single moms, or we're the breadwinners. So we are the ones who are taking care of the household. And when mom goes down, the whole house goes down. So I'm still in the fight, not giving up. For my birthday this year, I didn't want anything but the help to start a nonprofit to help women who are single moms in active treatment, to help them somehow, some way, financially. So yeah, I'm still out here. I'm still fighting. They say fight like a girl. I'm fighting like a bad woman. But I am here, and yeah, and I'm going to continue to advocate and fight on all costs.
Absolutely. Thank you. Thank you, Ebony. Yes, fight like a bad woman. This is, appreciate you just for being here and for your honesty and sharing about all that you have gone through. You can continue to go through. And something that resonates is just the cost to fight. I just keep hearing that from all of you as you're talking about this. And with that, I would love to turn it over to Dr. Megan Edmonds, who is, Megan Edmonds, who will, I'll give you a little introduction, and then we'll kick her off so that she can provide her presentation. So 1 moment. Okay. So bear with me. Okay, Dr. Megan Edmonds is a population health disparities researcher. Her research focuses on assessing breast cancer disparities using population level data and mixed method approaches to improve late stage detection of cancer, the use of mammography and other survivorship care services in Black and underserved breast cancer survivors. Dr. Edmonds' program of research is centered on improving the implementation of follow-up care and late effects from cancer treatment among Black women. She is a published researcher and has presented her research at several national conferences. Dr. Megan Edmonds is, she has collaborated with the American Public Health Association and is currently serving at Mount Sinai. Dr. Megan Edmonds, it's so great to have you, and passing it over to you.
Hi, thank you. I just first want to say thank you for inviting me here, and just listening to everyone's story is very moving, and a reminder to myself of the why that we're all here on this call and the work that we do together. I consider myself a liaison for women like yourself, living the fight day to day. And when I say liaison, I'm literally just have a seat at the table that's just communicating, to make changes sort of happen and to really do the work. So I'll kind of get started. And I really want to have like a conversation with you all. For financial disclosures, I just want to list these here. And like yourself with having a personal story, I believe I was 17. No, I was older than that. I think I was about 18 years old when my mother was first diagnosed, and I was a student at Spelman College. And my world stopped. And I, very close with my mother. And so, we figured it out, we navigated it. And she was early stage, triple negative breast cancer, and we were in the clear. We were good. 2 years, 3 years later, a recurrence came. Again, call early, this time we're going to go more aggressive with treatment. And so she received a double mastectomy. And this sort of curative approach for treatment. And we were told the likelihood of it returning was low. And so we were, at a point where we were happy that this would not happen again, but also just, still just the trauma related to having a disease relapse. And unfortunately, it did return. And when it returned in 2018, it metastasized. And unfortunately, my mother passed away in 2018. And so I literally shifted gears. At that time, I was working more within public health because that is my background. But I did shift my lens and focus of my work to do more breast cancer research in memory of my mother. And I knew that if our situation, the problem that I had back at home was happening, I knew that it was happening for other women in terms of not receiving the appropriate adequate care in terms of the survivorship point, which a lot of you all have been talking. And so I'll kind of start with sort of big picture. Like, there are an estimate of 3.5 million breast cancer survivors living in our country. And that's a pretty big population when you think about it. And unfortunately, when we think about those 5-year breast cancer survival rates, this is sort of women who've already received treatment. They are, Black women are less likely to survive, and it doesn't matter the stage. So it doesn't matter if it's localized, regional, distant, or if it's a lower stage. And so that really concerned me when I started learning more about the disparities in rates for breast cancer patients, particularly within racial and ethnic groups of Black women. And I wanted to know why. So why is this? So even for women who have lower stage cancer, they're still less likely to survive at 5 years. Like, that's such a negative, statistic. So what are we doing to, change that? And I want to be a part of the force who works to change that. And I learned that, there is not no one response to why these survival disparities exist. It is attributed to late stage detection, not having access to resources to health insurance, as well as systemic racism within healthcare, environmental factors. So there's a host of factors, right, in terms of that are attributing to these survival disparities. But in terms of addressing it, you have many ways to sort of focus on that. And so when I think about the sort of work that I do, I focus on survivorship and sort of understanding how can we better manage the late effects from breast cancer. Some of you have mentioned lymphedema. That's one late effect from breast cancer treatment. And in addition to other effects that can be sort of having any side effects from the treatment, such as neuropathy or any sort of endocrine-related adverse side effects. In addition to the management of these late effects, you have financial responsibility, which is a big part of what we've been discussing today. In addition, you have other quality of life is shifting since diagnosis, the mental health challenges, and also within the context of what to do next after treatment. So how do we make sure we're receiving the right follow-up care? So if there is a recurrence, it's caught early and we can, keep living and surviving. But for the focus of today, I'll just kind of mainly focus just on one of these areas, which is the financial responsibility that takes place. And this is sort of defined as this financial distress. And it's defined in different ways, but sort of, increased out-of-pocket costs and how this is associated with a lot of distress for patients and this sort of burden of cancer treatment costs, which is something that, we've been discussing already. And also having been employed at the time of diagnosis, many women cannot continue to work, rightfully so. And so that work reduction and cessation occurs. And, depending on the type of employment you have, you may not be offered FMLA if you haven't been there that long, for example, because certain companies have restrictions of how long you've been employed to have those type of benefits. And so there's a lot of factors that flows into this like distress, when a woman is diagnosed and sort of after gone through treatment. And in addition to that, there's been different works that have sort of described what those financial, burdens are amongst cancer survivors in general by health insurance type. So a lot of times we say, if you have health insurance, you're fine, you're good, but it's not always the case. So based on this particular study, they define different health insurance types and sort of the significant rates of distress. So looking at it here, Medicaid at 61% when it came to food had higher levels of distress. And they also had other Medicare. Medicare actually was the best health insurance to have lower levels of distress across healthcare, food, utilities, household supplies, car, phone, et cetera, and childcare. So that seems to be the best insurance. But even when looking at sort of, overall and the other insurance types, I thought it was interesting just to share that this is something that is very impactful for many cancer survivors. And this was something that was taken from like a snapshot of cancer survivors during COVID, the pandemic, like right away. So now I'm kind of focusing in on breast cancer because that was sort of a larger population of all cancer survivors. When we look at breast cancer survivors, we're seeing that these are some of the coping strategies that patients have sort of highlighted as sort of, how they manage their financial distress. And that was interesting just to share that sort of decreased basic spending on food and clothing with some coping mechanisms. And I kind of heard that from some of you all. Decreased spending on leisure activities, using saved money to pay for cancer care, borrowing money through cancer care. So this is something that we've kind of already been highlighting, but this is also something that has been studied and sort of documented as well to sort of put proof to the numbers of the experiences that you all are saying. In addition, there's been another report, is sort of a larger cohort study of about 2,200, a little over 2,200 breast cancer survivors, where they actually highlighted sort of, by race, where women were sort of, within their financial circumstances since diagnosis. And many women, particularly Black women, felt that their insurance status was worse since diagnosis, and this insurance is health insurance. They felt that their employment status was worse off since diagnosis, as well as their financial status. And so even after adjusting for factors like age, income, and race, Black women in this particular study still had the worse off financial distress than the other racial groups. And when I led a study for, trying to understand factors that contributed to adhering to surveillance mammography for women who have had a lumpectomy, I discovered that women who had health insurance was a positive sort of protector for women to receive their annual mammogram, as well as women who reported having personal benefits from receiving a surveillance mammogram. But what was something interesting that I didn't, have, or we hadn't observed before, is that women who actually discuss surveillance and when I say surveillance, I want to make sure everyone understands that I'm referring to follow-up care. It's just sort of another way of saying screening, right? But just in the sort of survivorship setting is more so used to say surveillance. But for Black women in this study, we found that women who actually discuss their follow-up care with their physicians were more likely to receive the actual surveillance mammography compared to white women. And I don't have it here, but this was a sample of 266 patients. And excuse me. And this is sort of like just showing how, we were able to see that race communication effect for Black women having more communication, were more likely to have received a mammogram. And some other factors that we did see that contributed to having a mammogram were, again, like I said, women who actually perceive benefits as well. I did ask questions around financial burden, and that didn't come out in this study. But that's not to say it doesn't happen. It's obviously still there, but every case is different. So when it comes to receiving follow-up care, within this cohort study, I didn't see anything regarding financial burden, but I did do some qualitative interviews with patients, and we did see, for one patient, she says, I had annual mammograms. I emailed him once a year and asked if he wanted to see me. 20 years after my first breast cancer, I was diagnosed with triple negative breast cancer. I saw the same oncologist. I had surgery and no further treatment. The oncologist said that it was not necessary for me to come in. So here, a patient is kind of just sort of sharing her, follow-up care experiences with her physician, and sort of how her communication with her provider kind of really led sort of her, follow-up care. And another patient shared that one of her friends had an annual visit with her surgeon and he gave her a clean bill of health. She called me and as excited to tell me that she was good to go for another year. Several weeks later, she had a pain in her shoulder. The surgeon initially treated it as arthritis, but it was eventually diagnosed as metastatic disease to the bone. Have that little kind of got cut off there, but yeah, this was an interesting story that a patient shared. Unfortunately, a very common story where sort of the follow-up care, and misdiagnosing patients is unfortunately very common, particularly in African-American women. And so sort of that feeling ignored from physicians is a barrier for many women within their follow-up care, as well as I would also just sort of add mistrust for that patient, because that was sort of how the rest of the interview kind of had went. And so I've been talking a lot about like the data and the research. And so I kind of want to end the talk on sort of like, where is the silver lining in all of this and how can we better address these concerns? Because, we've been highlighting it, the experiences that you all are living and sharing, is documented. So what can be done? And I think that having this conversation today and, hearing from you all and just even having this event is a part of what can be done. This is advocacy. This is education at its best in practice. And so sharing this educational information with your peers and, also sharing financial resources with women. Many times it's just, you don't know what you don't know. And I could just think back to when we were going through the time with my mother, because I was her caregiver. I had to really, go to war with a lot of, maintaining FMLA, paying that, having grants for that. So it was a lot of work, right? And so I might be a little type A, so I was able to do it, but, thinking about other people and, the sort of, grit to be able to meet deadlines, to submit paperwork, and it's just a lot of work, right? So, that's still an issue. Like many hospitals, I work at a hospital right now, there is one person on the financial team, right? So, having more resources for women, to advocate for themselves and know how to advocate, particularly within their financial resource department of their hospital that they're receiving, or within the practice that they go to. I think policy changes is something too I'm really wanting to get more into research, and how this can level into policy changes. For example, there are many sort of different policies in terms of changing the screening age for breast cancer, because currently it was recently lowered to 40 from 45. But there's more work that needs to be done. And so I think that that's something I'd like to kind of, join to see just sort of what that policy change gravitates towards. I really want to highlight the Angel Advocacy Program. I think it is a beautiful, smart, it works. It's a beautiful program and provides a lot of resources for women, and many survivors still don't know about it. And so, having you all here today, I know that, just hearing from your stories, you're sharing information with everybody. So I truly believe that. And I think that even more so that there's more that we can do, because many women may not be as open, and have a big personality to want to join forces or be their own advocate. I actually started a LLC. This is when I was completing my doctoral study trainings, when I really wanted to sort of better translate the research that I was doing and working on. So I have a website that just provides many financial resources. It's at www.whywesurvive.com. I don't have every single resource on there. So if there's any additional information, I also am going to add like a link to Tigerlily, because they really have way more resources. But I think that, just having every little bit helps. And in addition to some of the work that I've done, I also work with engaging women of racial ethnic descent in research. And so we've done this through, understanding biospecimen donation, so like clinical studies to just help promote better precision in medicine. Participating in clinical trials is very important. The reason why, much of the treatment today is, where it is in terms of advancement, is because it's based on large samples of white women's genetic samples, right? And so there is a lack of information, particularly among racial ethnic women. And so there's a need to better, get that buy-in and participation. So we were able to improve our biospecimen return rate once we sort of revised our recruitment strategies. And this was a simple just providing saliva. And this was in the cohort of Black and white breast cancer survivors. And was happy to be able to do that. And sort of my last takeaways today, there may be some questions, I'm sure, or just sort of like feedback or comments. I think that you all are doing the work, and I feel like I work for you. Honestly, I really do. Um, and the advocacy is really at home for me. And so that's where I'm always, highlight and sort of say that that's where the change really happens, like within the community. You could participate and engage in research all day long, but if you're not connecting and translating it back into the communities through an advocacy approach, I just think that you're not really able to make that true impact and change. I also think that the peer navigation, such as the angel advocacy program that you all are doing, works and is proven that it works. Just, continuing that is important. And then I'll stop there because I'm over time.
That was incredible, Dr. Edmonds. Thank you so much for a wealth of information. The chat was going bananas.
Let me look at it.
Asking, I wrote them down, some of the questions.
Okay.
So, to be able to, get people to, to be able to share that. So I'm going to put us all on so at least we can have a conversation. As well, if you'd like to ask questions directly, please do that. One of the first questions that we had was, what do you do if you're denied testing, i.e. a PET scan? Could this imaging be included in surveillance?
Yeah, that's a really good question. I get that a lot. There are specific patient profiles that you have to meet in order to receive a PET scan. So for a PET scan, you need to have sort of a higher risk, criteria profile. It's good if you actually don't meet that profile, right? Because your risk isn't as high, you're not sort of a higher risk. But I think that, for some women, that's still not enough, right? Like they still want to receive every scan, every imaging. And so we definitely, just sort of like let many of the patients know that, seeing your physician, like having that follow-up physical exam every 6 months, like that should ensure, in addition to your imaging that you are eligible to receive, that should ensure, that you are good. But also just knowing your body too, right? So if you know something is off and not right, and if further scans need to be ordered, just saying that, and sometimes it's a matter of changing the practice, if they're not going to hear you. I work with many radiologists, oncologists, and this is sort of, a ongoing sort of conversation. They don't want to overly, concern patients and, in terms of over imaging and sort of like doing more. And so like there's that sort of, buy-in, what's needed. And so there would have to for sure be a, high risk, criteria for you to meet in order for that to happen.
Thank you. Another question we had is, can you do clinical trials if you don't have insurance?
Yes.
Okay.
Now, it's not every single clinical trial. It depends, all right? So every clinical trial is different. And that is a big barrier too. Like many patients, aren't even asked to participate. And so just, having the information obviously helps, but being able to ask, are there any clinical trials that may be eligible for me at your practice where you receive care, I think is important. And I didn't mention this, but also genetic counseling and testing for you, for the family. That's important, that's needed to sort of know what the potential risk is for other family members.
That was really helpful. I know one of the other questions, I see a hand is up too, so we'll get to, Marcia will get to you, is in the information that you shared, you talked about misdiagnosis, and that you gave that example of someone being misdiagnosed. We have at least 2 individuals on this call who are misdiagnosed as well.
Right.
And based off of your research, do you think is misdiagnosis linked to the lack of communication by healthcare providers? Because with your data, you were showing that with the Black women, or it was just that there was a different data that your data was showing from the study that it was that communication varied. And as it relates to the surveillance mammogram, but I'm just curious if you think that has anything to do with it too.
Yeah, I think that there's a lot that falls into the sort of, late stage detection or misdiagnosis. So I can't say that one over the other, in that particular study, I didn't look at misdiagnosis as sort of, my major outcome. So I can't definitively say that from a research point, but I can say that for, Black women in particular, and this has been seen in other studies, like that buy-in from the physician and having that, more of a sort of, trusting relationship and communication is real important for adherence to treatment, adherence to follow-up care, everything. So when that relationship, I believe that when that relationship is not as strong, there's many things that can go wrong. So I would just sort of, recommend having like that, really good relationship, trusting relationship with your provider.
Thank you. Okay, Marcia, I see that you have your hand up.
Dr. Edmonds, I was curious because one of the things that our sisters on here have mentioned is that they had good health insurance. So how can we be advocates for people that don't have good health insurance? What should we be looking into?
Yeah, that's a good question. Even those with good health insurance may have high out-of-pocket costs. So I think about it, in terms of access, it's very multifaceted. So, I think that being able to help out with out-of-pocket costs, regardless of the type of insurance, is important. And in like the first major study I shared, it showed the different types of health insurance and then like the financial distress associated by insurance. And so like food, housing, our health insurance don't pay for those things.
Right.
So, I think, you all are doing that. You all are providing a lot of resources around the food, housing, car, gas came up, like transportation. And so, and that's why I sort of mentioned like the importance of like the policy change, because like our insurance should cover that. If I'm unable to work, and this is a part of my livelihood, why wouldn't I be able to comp that out of my insurance? So it's a lot of work that need to be done when I talk about the insurance stuff. But I think that, paying for the other important necessities, utilities are very important.
Thank you so much. Appreciate you.
Thank you. Thank you. And I know, Dr. Edmonds, I know that I know you also have to hop. So I just wanted to thank you for
before, I know my phone is blowing up, but I want to make sure I answer any
there's another question.
Concerns, comments, anything from the women.
Yes, please unmute yourselves, ladies. I know there was one, Kimmy, you asked about
anything. It don't have to be a question, it could be anything. Do you all agree with what I presented? Do you feel like it wasn't, I don't know, just any kind of like takeaways? It'll be.
And you can unmute yourself.
Maybe. Okay, we're all in agreement. So we're all fighting, yes, and doing the work. And so it was great to meet everyone here, and I'm sure I'll see you all again.
Yes.
And yeah, is there anything else, Shonda, you needed from me?
If you could drop your email in the chat, if if people have follow-up questions, we'll share as well. We'll put this online so you can be able to see it. And
Yeah.
I'm going to, continue on with some of the questions because I know there was a question about resources for the caregiver, and we do have someone from Family Reach on as well, Fran Firth. So I wanted, Fran, if you could just, I'm going to add you, pin you. So if you could just provide some information about Family Reach and some of the resources that you all provide as well.
Of course. Thank you, Shonda. I appreciate you calling me out. My internet is a little unstable, so hopefully you all can hear me okay. For those who are not familiar, Family Reach is a national nonprofit, and everything I've heard today, and I just have to thank you all for sharing your stories, being so vulnerable to share your very personal stories, and they fit completely into the space of what we do at Family Reach, which is focus on the financial piece, the non-medical financial piece of a cancer diagnosis that no one talks about. All of the things that you've been sharing and focusing on here, that's what we are focused on addressing. So we're doing that in many different ways, or trying to do that as best as possible in many ways. So we've created what we call a financial treatment program, believing that you should have your medical treatment program and you should have your financial treatment program. And that comes with many different aspects. So we certainly help as best as we can with financial grants for those non-medical expenses. And hearing what some of you shared, Eboney mentioning, do you pay the light bill or do you feed your kids? That's our mantra, that we don't want anyone to have to choose between their health and their home. And those are very, very difficult decisions. And I'll get to the adherence and survival and all of the things that happen downstream. So certainly we provide grants wherever we can to help with those non-medical expenses. We provide financial education. We have a program with pro bono financial coaches. People figure out, here is this whole basket of bills that I can't even begin to open up because I know they just want me to pay. Where do I start? What do I do first? How do I get through this? So that's a pro bono service available to patients and caregivers. And then importantly, we have resource navigation. So we have on staff licensed social workers that help caregivers and patients figure out what other types of resources are available, whether they're local benefits, state benefits, national benefits, other types of nonprofits that could potentially help. And so we really try to navigate whether it's the caregiver or the patient themselves through this to get access to those kinds of resources. So that's really what we do, but we're digging in so much, and this whole conversation around communication and trust. And what we know is that, people are not having these conversations. The providers are not bringing up all of these financial aspects. How much is it going to cost? How much time do I have to take off of work? All of those things that can then spiral people into a very quick downward spiral into this whole category, what we call financial toxicity, that is just rampant and everywhere when folks are faced with a cancer diagnosis. So how do we educate those, whether it's the caregivers or importantly, empower those that have this diagnosis to have these conversations, to let them know that unfortunately, if the providers aren't coming to us, we have to be able to have those conversations ourselves. But it's really scary. And especially when there isn't trust, it's really difficult to bring this forward. So we're working on different types of educational, very digestible information, one pagers to share with patients, to be able to have those conversations, when to have them, who to reach out to. If you don't trust your doctor, is there someone else? Is there even a friend or someone in the community? So really digging into how we can help to advance the communication so people have these discussions before information forward, and if there are questions.
Yeah, thank you, Fran. Thanks for sharing that. Lots of, yes, and I'm thankful that you're on this call too, to be able to answer some of those questions, and for all that Family Reach does. I know that we help to collaborate together on that financial barrier toolkit that we have. And I know Kimmy, who's on, she had a question. Does Family Reach have any resources for post-active treatment? Now I know, okay, we might have lost her, because I know she was saying her connection was a little bit poor, so hopefully she'll come back. But yeah, one of the areas, and that's, it's really us being able to connect with different resources, and connecting with different nonprofits. Like Faridah, I know that you were sharing about some of the other nonprofits that have helped you to provide resources. So Family Reach is one of those too, as they mentioned too, about being able to provide pro bono financial support. In that sense, and having conversations about with a financial advisor to be able to talk about that, creating that financial plan. I will definitely get that information or that question answered, and make sure to share that with you all, as well as we do have some direct contacts within Family Reach that I can share with you and provide that for you. Another sort of also supports the system. And I'd love to hear from you all, like, what are some of the support, different resources that you've used, been able to utilize during, this, like, navigating this experience? I think one, and especially like even the post-active part.
Okay, this is Faridah. Hi. For post-active, I was one of the companies one of the nonprofit was the Survivor's Nest. And what they did was you went on the website and you applied for the grant. And what they did was they awarded me a $200 grant to Whole Foods, so I can go and buy, healthy and nutritious food as I'm recovering, and going through survivorship. And so, yeah, I just wanted to share that information.
Thank you. I see Kimmy talked
you.
about ShareChat in here as well. They're another great partner that you can also be able to get support. Okay. I did find so I think I may have found a part of the answer to your question, Kimmy, from the financial treatment program. It says, in order to qualify, you have to be either in active treatment or have completed cancer treatment within 1 year. And receive treatment at a hospital within the 50 states, basically in the US somewhere. So that, I think, is, some of for the financial treatment eligibility program. I guess I'm curious too, is if once you're in the program and it's more than a year out, if that continues, if you continue to have that. So I do have some follow-up questions. I think that we'll have to have Family Reach on so we can get some of those questions asked as well. So let me see. I don't know if Fran's back. Awesome. Hey, Fran. I think that we got kicked off. There were more questions in the chat for you, but one of them is about the resources for post-active treatment. I did see on the website that for the Family Financial Treatment Program eligibility, it says that you have to have completed cancer treatment within a year. What if once you've applied to the program and you're done with treatment within that year, but you still would like to be a part of it? Is it just that you have to be enrolled within that year?
Yes, thank you. Of course, my internet kicked me out at the most inopportune time. So yes, we do have guidelines for access to the financial treatment program. And that really is for eligibility reasons, for access to our resource navigators, and certainly for access to financial grants. And candidly, it's only because we certainly can't help everyone through their entire journey because the funds are limited. So we do as much fundraising as possible to be able to provide those funds. But in terms of things like the financial coaching, if you've already been paired with a financial coach, those conversations can continue on post active treatment or post that 1 year. There are times that certainly there are situations where people come back to us after a period of time and can reapply for services. So it really does depend what is needed, but we are always going to try to produce additional kinds of resources, webinars for caregivers, and hold different kinds of sessions and one pagers like I shared focused on communication. Those will always be available to everyone at any point in time.
Thank you for that. Yes. Yeah, some of the comments, survivorship is hard, and that's something that we're also trying to, be able to get. I think it's helpful that, I know everyone's trying to do their part in the process of being able to give that. So thank you, Fran. I don't know if does anyone else have any questions for Fran about Family Reach? I did share, Fran, well, you may have been offline, that I'll connect, share them and connect the information with them too, so that they can be able to follow up.
Wonderful. Thank you.
Mhm.
And feel free to provide my contact information as well.
Okay, sure. Well, if you don't mind putting it in the chat, that'd be awesome. And then they can follow up with you as well. Okay. All right. Because most think you can just sound, yes, your life is forever changed. Absolutely, Faridah. Yes, most people think that you can bounce back, but it's a new normal. And you're trying to still adjust and adapt through that. So I know we have a few minutes left. I just wanted to pass it over again to our patient advocates, patient experts, if there's anything that you'd like to comments or anything that you would like to share with the rest of the group before we log off for the day.
This is Faridah. I just wanted to say thank you guys for having me here. And I feel like I'm getting more comfortable expressing and sharing information. And I feel as if when I share, information that I'm helping someone, even if it's just one person or if we're sharing information together that we can take out into the communities or our families or someone else, then I think I'm doing my job.
Thank you, Faridah. Kimmy or Eboney?
This is Eboney. I would also like to say thank you. Like being metastatic, and being misdiagnosed, I definitely try to get my story out, as much as I can to help others. But I also wanted to say, that a lot of people, they don't have to do this alone. A lot of people don't know about patient navigators. If you don't know much about that, ask your doctor, either your doctor's office or somebody for that information, because some people, they're scared to speak up. They don't have that oomph to speak up for themselves. And your patient navigator, especially if you have a great one, they will speak, or they should speak on your behalf. I didn't have one. So what I did is I went through a program through GSW and became one. So, yeah. So if you need a patient navigator, look, I'll fight for you, me, and everybody else.
Eboney, listen, okay.
So yeah, because I know all the fights that I've had to fire doctors. So I went through the program and became one. So I'm able to go to doctor's offices or speak over the phone or do whatever I need to make sure that people get that information, the information that they need, because we only get one life to live. And, for some of us, this is our new normal. And so just because this is your new normal doesn't mean that you have to be a statistic. So get all the information. I'm constantly looking for different things and information and new information to make sure that we're out here living and being able to live our best life.
Yes, just because it's your new normal doesn't mean you have to be a statistic. I know that's right. Ebony, thank you. Yes, that all of that to everything, and for just you being everything, training to be a patient navigator. I mean, what? You are such a resource. And so, I mean, if anyone, you're going through it and you're being a navigator, that's a whole other conversation that we're going to have for another day. We got to have you back on to be able to talk about that. Phenomenal. Kimmy, any comments too, or that you want to share?
Well, first of all, I just want to say thank you for the opportunity to share my story. I always wanted to know what my why was. Why did I have cancer when everything was pointing that I shouldn't have cancer? And my why was to help others. So I'm thankful for the opportunity to share my story in the hope to spark change in my lifetime. I did get a lot of nuggets to take away from this chat, so I'm thankful for that. For Dr. excuse me, for Dr. Edmonds to share the information that she did, because I'm always looking for. I know when people ring the bell, I think that's it, but cancer doesn't stop there. It's just the beginning of our journey. And we do die to self, and we are reborn into another being. And so we're trying to figure out how to navigate this new normal. So having those resources in order to help not only myself, but other people in my community is great. So I thank you for that.
Thank you. Thank you, ladies. Thank you, Lisa, too. I know she had to hop off a little bit earlier, and Dr. Edmonds. So grateful to have you all on. Please make sure to follow these phenomenal women on their Instagram. Denisha's gonna drop that in the chat for you all to follow that. And we're gonna also share this. This is going to be shared on our YouTube channel, so you'll be able to review it, listen to it, get some of these resources that we will share with you as well. I just want to thank you all for creating a space and for being brave and for sharing this information, as well as being able to provide resources to others. My prayer for all of you is that that God continues to bless you, and using your voice to continue to not only bless others, but that He may bless you in return for all that you're doing and answering those desires of your heart and the needs that you all have. And I hope that our community will continue to be able to support you emotionally, spiritually, and financially, that you'll be able to have that freedom, that liberation that comes with, the stage that you're in your life. So I just want to thank you all. Thank you again for everyone who's been listening in. Love to everyone. And we'll see you all next month. By God's grace, we're going to be talking about caregivers. So huge other part of caregivers. Thank you all so much and have a blessed weekend. Bye.